right, great. Can everybody hear me okay? I guess that's the first thing, because I can't see people, so it's hard to know if there are any issues. So you can hear me okay?
I can hear you perfect.
Okay, perfect. So I'll assume everybody else can. I can't see who's on. So thank you and welcome everyone. So today's session is an introduction, basically, to critical appraisal of qualitative research. Excuse me. The reason this is only an introduction is that to cover a topic in this much detail would require a significant amount of time, more than we have here today in less than an hour, because it is quite an extensive topic and one that requires quite a fair amount of time to learn well. But in the short time that we do have, I hope that you leave here with a better idea of how to go about conducting a qualitative critical appraisal. So this session is really for the novice researcher, the novice qualitative researcher, I should say. But it's founded on the premise that you as an audience at least have some basic understanding, at least, of qualitative research methods. If you're a qualitative research scholar, you probably will find this session to be really basic, and you probably won't get out of it what you had hoped. So it's for the beginning researcher, beginning qualitative research, to really start thinking about how we do this and next steps in the learning process. So if no one minds, before we really get into the session, maybe a few of you would like to share any expertise you have in qualitative research and or qualitative critical appraisal, for that matter. I don't expect everybody. I think on my list I have about 35 or 40 people, but if some of you might share where you are in that learning curve on researching qualitative critical appraisal of qualitative research, just to give me an idea if this presentation is really catering to what you are expecting or what you need to get out of it. So maybe a couple of people could just step forward and state a little bit about your background in, or if any, in qualitative research methods. I'd love to hear from anyone.
Anybody want to go first?
I don't need to hear from everybody, just to get a sense of who's out there and what you already, what you have, what you know, and what you might expect to get out of the session today. So a very quiet group.
Yes.
And I'm not going to pick on people, so that's okay. No one wants to share. No?
I don't.
Okay, that's fine.
Hello, I might share. I don't have a big experience in qualitative research, but we are now trying to appraise it a little bit better and to understand a little bit better how it goes. And me and my colleague, we have a master's student, and she is in part working on qualitative research. My colleague, because she's more expert than me, so eventually she's like following her more. And that's why I wanted to attend this meeting eventually, just to learn a little bit more.
Okay, that's what I kind of expected people to be sort of in that align with that. Most people, a lot of people, especially graduate students, are much more comfortable with quantitative research. Not everyone, but certainly a lot of people are, and it's quite a big difference. It's very two distinct methodologies with distinct approaches, and it's very difficult to carry over what we know about quantitative research into qualitative. Does anybody else want to speak up before we move on?
Yeah, I can jump in. My name is Katya. I'm in Montreal. I'm at the MUHC, and I've just recently started as a postdoctoral student in nephrology, but I am actually a qualitative researcher. So I do know quite a bit about the different appraisal, I guess, approaches, but I have not actually, I think I'm still developing the skill of actually using them in my own research. So I'm looking forward to just learning from others who have used some of these approaches in their research.
Fantastic. And I've been doing qualitative research for 25, 30 years, and I'm still learning. And qualitative research is still evolving. actually.
Mhm.
And then every once in a while, I'll hear something and I'll think, oh, goodness, that is quite a different methodology or a different approach to the methodology. So yeah, we're always learning. So I really hope you get something out of this today. Again, a lot of it might be very familiar with you, maybe too basic, but there's always something we can learn when somebody else is discussing something we're interested in, isn't it? Fantastic. So I think we probably have varying levels of expertise in qualitative research. And again, the twist is we're going to try to focus on critical appraisal of this qualitative research. So, hopefully everybody at least has a basic understanding of the more common qualitative methodologies. So if you look at my introductory slide, you will see that I have 4 logos on the slide. I think I have a pointer here, or I don't know if you can see that. But there are 4 logos on my slide, and they represent the 4 main themes of this presentation. And they're namely research, obviously, evidence-based practice, the Joanna Briggs Institute, Better Evidence, Better Outcomes, and CASP, which stands for Critical Appraisal Skills Program. So those are the themes around which this presentation will evolve. So to begin, I guess the key reason why we do critical appraisal of any research is to evaluate the evidence as to what we use, so that we use the best evidence that's available out there in our everyday discipline, in our everyday practice, whether it's pharmacy, medicine, nursing, or whatever healthcare discipline that you are working in. The idea is that we want to use the best evidence, and not all evidence is the best, and not all evidence, as we know, is good. And there are varying degrees of evidence and how much we can rely on them. So the critical appraisal checklist tools that I'll be presenting today are basic. There are a lot of them, but I'm going to focus on the JBI, the Joanna Briggs Institute checklist, and the CASP appraisal checklist for assessment of methodological quality. Okay. Yeah, I'm going to attempt to change my slide here. Okay, great. So our objectives, we have 4 objectives today that we're going to cover. First is being identify the importance of critical appraisal of qualitative evidence, qualitative research evidence. And I think most people will have a fairly good idea about that one. Well, we will review that as well. We're going to present the different approaches to critical appraisal of qualitative research. And I also want to discuss systematic critical appraisal and synthesis of qualitative evidence, which I think might be a little bit more or less known about, and maybe with this audience, and with even with qualitative researchers. And the 4th objective is to present the JBI and CAS as examples of systematic appraisal tools for assessment of methodological quality and qualitative research. So those are our 4 main objectives for today's session. Okay. So starting with the basics, and it is really the basics, why do we need to critically appraise qualitative research? Qualitative research, well, we know it's becoming increasingly used in evidence-based healthcare research in the last few decades. And when I did my first qualitative study back in, oh goodness, 1992, that's my thesis, and as a Master of Nursing student, qualitative research was out there. It was becoming a little more common, but it certainly wasn't well known, well used, or even well accepted by the more stringent scientific community. And so in my thesis, I really had to defend why I was even doing qualitative research in the first place as a scientific method, which was quite interesting when you think, and I'm sure most of you are much younger than I. And so, you don't have to go through those rituals right now as to, qualitative research. Why are we doing it? Is it even a valid or reliable method of doing research? So that's, that was 35 years ago. Thankfully, we've come a long way since that, and it's recognized as one of the 2 main paradigms in healthcare research. So, it is being more commonly accepted. It's very accepted, actually, and more commonly used. So we do it because sometimes we just don't want to quantify or statistically portray the data or the findings. So qualitative research focuses on individuals and gives voice to the patient or the client, if you will, or the provider in the healthcare decision-making process. It represents the human dimensions and experiences of the givers and the consumers of healthcare. So this type of research does not answer questions about the effectiveness of healthcare. Rather, it provides important information about things such as the appropriateness of care or the impact of illness, for example. It also provides a means of giving consumers of healthcare a voice in their decision-making process through the documentation of their experiences, preferences, and/or priorities. So qualitative research has a particular role in it, and exploring and explaining why interventions are or are not effective from a person-centered perspective. So therefore, it's really important to assess the methodological quality of a qualitative study to determine the extent to which a study has addressed the possibility of bias in its design, conduct, or analysis. And it's just as vital as the appraisal of any quantitative evidence. So again, we have to assess whether this evidence is good evidence that can be translated into healthcare practice. So if the study is of poor quality, then we as consumers of this evidence cannot be confident that it represents the best evidence for practice. So critical appraisal of qualitative evidence is a key step for evidence-based practice. In other words, finding the best evidence to aid in clinical decision-making in healthcare and addressing questions related to its usability, meaningfulness, feasibility, and appropriateness of care interventions. So it is important. And we know that we need to hear the voice of the people that we are caring for, or even those that are doing the caring. Okay. So here now, let's just make sure I'm on the right slide because I can't see. So critical appraisal of evidence at its beginning in quantitative research, but qualitative research has really, as I said, taken off in the last 30 years and has received, as well received as important for evidence-based healthcare in all disciplines. As with critical appraisal quantitative studies, there are certain key criteria for assessment of methodological quality in qualitative research. Because of the nature of qualitative research methods, however, we can't use the same criteria as we use for quantitative critical appraisal. We must have our own criteria. And I'm sure most graduate programs and undergraduate programs, for that matter, include criteria in course research syllabi. I would be very surprised if they don't. I know in nursing, we discuss both quantitative and qualitative critical appraisal. Academic research journals themselves are now providing very extensive guidelines to follow for what needs to be included in the manuscript. And these criteria can likewise be used for critical appraisal by the knowledge user or by the authors. So when you go in to upload or to look at what a particular academic journal is requiring for a research manuscript, those standards that they have there are a very good way for the beginning qualitative researcher to use as a guide, as a critical appraisal tool. You can actually use those. So likewise, there are many criteria that are set forth in textbooks, research textbooks, or those that are used in research journals that can be used. They vary slightly, but they usually contain many similar key appraisal criteria. So let me just present one example of the criteria published within the author guidelines for a journal that can be used as a guide to critically appraise qualitative research. And the example I'm going to give, it's not, there are a lot of examples out there that I could use, but I particularly liked the ones that, for example, the Journal of Implementation Science, which is a very good journal. And I chose this particular journal as an example because I felt that it covered the key critical appraisal criteria to assess qualitative studies. So these particular standards, and they call them standards, although they're designed, as I say, as a guide for authors, they can also be used for appraising a critical appraisal for assessing qualitative research. So there are 21 standards for reporting qualitative research, and they're published in the Journal of Academic Medicine, and that's in September, if anyone's interested, September 2014, volume 89 and issue 9. Now I'm going to just attempt to link on now so I can hit the link here, hopefully pull this up. If I don't, I think I have it on my laptop, then I can share my screen with that, but just see if the link, hopefully the link will open. Okay, so this is an article that was written by O'Brien, Harris, Beckman, Reed, and Cook, 2014 on standards for reporting qualitative research. So this is one of the ones that implementation science uses, and there are others that use these guidelines as well. So if you come down through the article, you will see standards for qualitative reporting, and I'll pull that table up. Hopefully, I don't know if it's going to be big enough.
Sorry to interrupt you. Just so we can see it, you got to share that actual screen you're on now.
Can you see? You can't see that there, can you?
No.
Okay, so what I'll do is just I have it on my laptop, so maybe it's best to pull it up that way.
Okay, and then yeah, you got to hit share screen again, and then when you see everything open on your computer, you click on the journal you have open.
Okay, let's give this a try. I knew this was going to happen. All right. So I'll just pull that article up there. Oh, maybe I won't be able to, but we'll try. Okay. Not sure. I hit stop sharing screen there, Amy. Okay, let's see. And okay.
Amy, you're muted.
Oh, sorry. Do you see the article there when you hit share screen?
I'll share the screen again now. Now, get back to share screen. I don't know if I can get back there.
It's just on the bottom there of your.
But on the bottom now, I just have my computer icons. So.
Oh, go into your Zoom again. Like just click on your Zoom icon on the bottom.
Yeah, I'm doing that. Yeah.
Okay, on the bottom, you don't see share screen there on the bottom?
No, I don't. I have, wait, now I have you there. When I click that, when I click the icon, it's just you. I don't know how to get back into there. This is the worst with this. I'm so used to WebEx and Brightspace.
Yeah.
And so, I have the standards for reporting qualitative research, or the SRQR, up there now on my screen. It's just a matter of getting back to just this join meeting.
So
icon is set. I have two little icons under the Zoom. One says to join the meeting, and the other actually is wait, now maybe if I hit this one big here, let me try this. Oh, I have it.
okay. There you go.
Right, bear with me. Bear with me. I found it. Sorry, everybody. I'm not very technologically savvy. There we are.
There you go.
Is that it? Thank you so much. Thank you all for your patience. Okay, so these are the standards I was just referring to for reporting qualitative research. And many manuscripts or many journals will require for your manuscript, they will list the SRQR as the standards to use in your reporting. But I think these standards can also be used as a means of critically appraising qualitative research. So like any critical appraisal, of course, you start at the top and you work your way down through the different aspects of the manuscript. The thing is that because there's, in the first instance, these are developed as standards, if used for critical appraisal of research, some of the standards for reporting are more important than others. And namely those that focus on the methods used in the study and also the results. So the methods and the results section are are the most important standards that you need to look at if you're deciding whether this particular evidence meets the merit of being good, solid evidence. So you would focus on the methods and the research findings. Now, a little later in the presentation, we're going to talk about some systematic critical appraisal. And you will note when we get to those, that those are mainly about the standards. And I'll talk about more about that in a few minutes. But from, someone who's just learning how to critically appraise qualitative research, or even beginning to write qualitative research reports, this is a very good way to begin. So of course, these are, as I said, they're designed for authors by the journal, but again, they're very good criteria to look at. So they talk about the title, they talk about the abstract, and if you notice that they had the topic and the item, they list in detail what one expects to find in each particular category. When it comes to the title and the abstract, generally, when you're doing a critical appraisal of the evidence, we don't tend to put a lot of weight on whether the title and the abstract are done well. And they certainly wouldn't be a reason to throw out, like even with a quantitative study, you wouldn't throw out a study because you didn't think the title clearly reflected the topic or the population, or the abstract missed certain key factors. But with critical appraisal, it is important to look at those and to see if they're well done. Likewise, with the introduction, you look at the problem formulation and the research question. And even though, again, we typically don't put as much weight on the problem formulation and the research question when we're doing critical appraisal, these are still key factors in whether this is a good study. And one of the things I really want to point out, you can read those for yourself when you get time, you can spend more time looking through these for time purposes today. I'm very briefly going through these. What you need to look at here with regard to the introduction is how that introduction in regards to, for example, the research question ties into the next section, the method. So even though we put more focus on the method, whether this was carried out appropriately, with sound, solid study, the research question really sets the stage for the next part of the research, doesn't it? So we have a particular qualitative research question. Well, not only does this qualitative research question, if you're a qualitative researcher, we know that question has to be clear. Any research question should be very clear as to what it is you're planning to do in this research. What question is it you're planning to answer? And likewise, if it's the aim of the study or the purpose of the study or the research question, depending on the way it's written, that really needs to link in well to the methods. So if you propose a study, for example, that's looking at, and we see this is a very common one, the lived experience of someone who's undergoing a particular medical procedure. What are they going through? What is that lived experience? We know as qualitative researchers that that's probably going to be a phenomenological study. So there should be a link between the research question or purpose and the method that one chooses. So that's why the question is still a very important thing to assess, because is there that congruency between the question or the aim of the study and the method the researcher uses to answer that study? And amazingly, it still happens quite often that, there are the how questions, the why. We know if there's a how question, it's probably going to be a grounded theory study, not necessarily, but, these are things that as qualitative researchers, we expect certain types of questions to be answered using certain methodologies, same as quantitative. So is there that congruency between the research question, the problem, and the method and/slash approach, because there are many approaches to many of the methods that we choose to do our studies? And I'm doing this rather quickly because I said these things take years. There's courses. This is 1 hour. So I'm just going to try to give you an overview of certain key things that pop into my mind that I think this is important and sometimes get missed. Another very important one is, if you look, it's called researcher characteristics and reflexivity. And the reason I'm pulling this one out is particularly important as well. This is one that gets missed quite often in research reports, but it's very important. And I am noticing that my dog is barking. I apologize. One of the distractions of working at home, that academic journals and research reports are requiring more and more often that this be included. And this is really important. And the reason it's very important is that quite often we as researchers, qualitative researchers, we study things that are close to our work area. So, if you're working on oncology or you're working cardiology, obviously you bring with you a vast amount of experience, clinical experience, academic experience, teaching experience. You bring that into the study with you. So quite often that can, and I don't want to get into a qualitative lecture on reflexivity and researcher characteristics at this time, but we often bring with us a lot of suppositions, don't we? We have ideas, thoughts, and knowledge about a particular topic, just because that's our area of expertise and we're doing more research in it. So what the authors are asking in number S6, researcher characteristics and reflexivity, is that how is that influencing your research? How is that biasing your research or affecting how you analyze your research, report your results, or even is it? And if it is, what did you do about it? How did you deal with it? So it looks at how you or how the researcher might be affected by all this knowledge that you bring with you when you do research. And that's very important in qualitative research because it's much more a subjective type of paradigm as opposed to quantitative. And we know that can affect quantitative work, and that's a whole different topic. But for qualitative, in writing your report, you sometimes expect your participants to say certain things, or maybe you read into it what they're saying because you have these preconceived ideas from your clinical practice. But needless to say, this is an important area that needs to be addressed in any report, and it's quite often not addressed. Likewise, not only your personal knowledge characteristics, the setting, the context, how does that affect the research report? So that's one of the things now that I find that journals are really expecting to see a section or see a write-up on this topic. And so that's something you should be critically appraising yourself. What is the effect of the researcher's knowledge on the research? So I did want to point that one out. Again, context. And the other items that one would look for, the other criteria, how do we do our sample? Again, that's one would expect your sampling technique, saturation, of course, with qualitative work. And again, think about the difference between data saturation and theoretical saturation, which are new researchers sometimes get confused, but again, that's another topic for another day. Ethical issues, did it go through the right channels? Was ethics carried out appropriately? The consent procedure, these are very important things that you should be looking for. The data collection methods, data collection instruments, the units of the study, number, the characteristics of the participants, etc. Data processing and data analysis. So these are quite standard as far as what you would expect to see. The thing that another thing that I want to point out when you're doing critical appraisal using any of these standards, and these are very straightforward common standards, is there that congruency? When you start off saying, this is my question, or this is my research problem, or this is the aim of my study, is there congruency to this is how I'm going to do my study? This is the methodology. I'm going to use phenomenology. I'm going to use hermeneutic phenomenology. I'm going to use an approach by Dickelman that is consistent with hermeneutic phenomenology. and then this is how I'm going to collect my data, this is how I'm going to analyze my data. Are all these things congruent? You know, is the right method for the research question? Is the right method for the right approach for the methodology that you chose? So, you know, I find that researchers are doing a really good, qualitative researchers are doing a really good job with that. But sometimes you will see inconsistencies, and it's not as much as, oh my, you know, they're saying that they're looking at lived experience and now they're doing grounded theory, which moves at more psychosocial processes, but also does contain the experience piece. It's not that explicit. Sometimes these incongruencies are more subtle. And certainly when you get into any philosophical orientations, sometimes researchers, novice researchers, are not really clear about philosophical links or philosophical underpinnings of the methodology that they chose. So is there that congruency between, you know, again, starting from the question right down to you using a method, philosophical underpinnings, and did they carry that throughout the entire research process? And if we had more time today, we could actually do a little practice run on, because sometimes you think it's got to be clear, and then you read it and you think, you know, they say they're using hermeneutics. Maybe this one's too basic, but they're talking about description, and so they obviously don't know the difference between Husserlian and Heideggerian. So you really had to know your methods to be able to critique some of these studies and to be able to critique them well. So it's not always clear cut. So just to finish off on this particular, these standards to be used, that can be used as criteria. As I said, the methods are the most important, but there is that follow through that one needs to be very careful about. And again, and you're going to find this when I get into more stringent or more standardized systematic review of critical appraisal, it's very subjective. So what you may think is, I don't know if we should use this study. Is this a methodology sound enough? And I may read it and say, look, you know, the problem is more with they didn't talk about reflexivity and context, but it's really a good study with really good data. So there can be a lot of back and forth. It has to be a lot of dialogue between the researchers on the team sometimes when you're doing critical appraisal to flush out, is this a good study? Because there is that big element of subjectivity. And sometimes there's a fine line between, is this a good study? Even though they didn't talk about reflexivity, and they didn't really describe their characteristics of the participants well, but God, they got some good data there, and they did a really good analysis. So you have to think it through and make that judgment call, and it's best to do it with another researcher. Okay, so this is just one way of doing critical appraisal. However, as I said, there is a more stringent way to appraise the evidence, and that is through a systematic appraisal. And that is what it's called, systematic appraisal. Now, this may seem systematic to you. And if you're not familiar with systematic appraisals, you might wonder what I'm getting at. But there is, this is a different animal. So a systematic appraisal is essentially an analysis, again, of the available literature, that is the evidence, of course, and it's again a judgment of the effectiveness or otherwise of a practice involves a series of complex steps. So using standardized, rigorous, and transparent methods, usually referred to as a critical appraisal checklist. So I really had to bring up my slides again. So again, bear with me. Maybe I'll be a little faster this time. Okay, and slideshow.
Okay, yeah. You can see it again.
Okay, so we want to talk about systematic critical, I'm on slide 5, critical appraisal of evidence. So systematic critical appraisal, really is the core of systematic evidence synthesis or the systematic review. And I'm not sure how many of you in the audience are familiar with systematic reviews. Maybe you've all done them. Maybe you haven't. I'm sure you're aware of them. I don't know if anybody here has done training in systematic review. Has anybody done training in systematic review, or is it? Are most people aware of it, but really haven't gotten into it? Oh, I should have had my chat.
Katya said she was.
Okay. So again, I apologize if this is very basic for most of you, but I'm sure there's some people in the audience that this might be new material. So hopefully there's something in there for everybody. So as I said, the systematic critical appraisal is the core of systematic evidence synthesis, or the systematic review of literature, all by particular intervention. It can be about a condition or an issue. So although we're not going to get into how to carry out a systematic review in this webinar today, obviously, I do want to point out a few key points when conducting a systematic review, just to introduce you to what it is if you're not familiar with it. And also so that I can more sort of easily segue into the critical appraisal piece of the systematic review, which is the focus of the webinar. So very briefly, just review what a systematic review is. So systematic reviews aim to provide a comprehensive, unbiased synthesis of many relevant studies in a single document using rigorous and transparent methods. A systematic review aims to synthesize and summarize the existing evidence. It attempts to uncover all of the evidence relevant to a research question. Not only does it uncover and synthesize all the evidence relevant to a particular research question, but it also critically appraises the quality of the evidence, or grades. We call a grading system, grades the summarized data itself. In other words, how dependable or credible are the pooled qualitative findings? Okay, so of course, this is dependent on the quality of the individual interviews included in the studies, or included in the review, sorry. The process of the grade, which is capital G-R-A-D-E, the process of the grade that is given by the reviewers is such that it tries to remove some of the subjectivity I was referring to back when we talked about more broadly how to critically appraise using journal standards or using textbook standards. But even with a systematic process of critical appraisal of the research, there is still a strong element of subjectivity. And I'll come back to this and hopefully demonstrate this a little bit later on. Okay, so just to touch on the systematic review. Okay. A few other important points about systematic reviews that I would like to note, even though we're not going to get into it in great detail, and some of you are interested in it, is that, first of all, because there's a synthesis of a lot of literature, it can be a synthesis of 2 or 3 articles. It can be a synthesis of 500 articles, depending on your research question and how much literature is out there on that question. Okay, so the more that's been done, obviously, the bigger your systematic review is going to be, and much more complex, and it's a very time-consuming process. But the search strategy itself is fundamental to a systematic review. So if you're ever thinking about doing systematic review, search strategy is the key. You have to get all the articles, all the literature that is pertinent to the question. That's not simply just a matter of, okay, get all the literature that's been ever done. It's qualitative literature, because we're talking about qualitative systematic reviews. It's not just a matter of getting all the qualitative literature out there that's answered the research question, but to get ones that really meet certain criteria, because systematic reviews are very stringent criteria. You have to get a certain population in a certain context. So there's what we call the PICO, the population, the outcome, all these kinds of things are important in the context, etc. So it's a very systematic process that needs to be carried out correctly. And in order to do this, if you're going to do a systematic review, unless you are a fantastic librarian yourself, get a librarian on your team. Okay, and I certainly have one on mine every time I do a systematic review. And research itself on systematic reviews has found that a poor search strategy is a common and major methodological weakness of systematic reviews. Okay, and it can really threaten the credibility of the reviewer's findings, and its role as a reliable source of evidence-based guidance for interventions or appropriate care in clinical practice. So it's imperative to have a librarian on the research team. The other thing I would say, you need a minimum of 3 people, yourself, another reviewer, and the librarian. And I would strongly suggest that at least one of you, including, not including the librarian, have systematic review training. Okay, because there is formal training on how to do systematic reviews. And so if you're going to be doing systematic reviews, if you want to do them correctly, you really need the training, and you need the right people to do the job properly. Another important point is that although there's a lot of approaches to conducting systematic reviews, and again, training is essential, there are different assessment critical appraisal tools that can be used. And most of these are aligned with the training program that you undertake. There are various training programs for qualitative critical appraisal. The ones I'm most familiar with are the CASP, the CASP, or the Critical Appraisal Skills Program. And this was developed quite often used in public health. There's the JBI, or the Joanna Briggs Institute, which is the one I am trained in, and for qualitative critical appraisal, and I'm most familiar with. And there's the Cochrane, which I have limited experience with. Systematic review training is formalized. It takes a long time. And that's only for the systematic review training. You can get training in scoping reviews, implementation reports, etc. But for the systematic reviews itself, it's initially a 1-week full-time training session. I did mine at Queen's University. And then there's other training that you're always upgrading and doing seminars to, things change, things grow, they get better. And so you have to keep up on it. So it is very formalized. So I would, if you're interested in this type of work, I would highly recommend to get training. Okay. So very briefly, I'm going to talk about the 2 that I'm familiar with, and that's the CASP, the CASP, and the Joanna Briggs Institute, or the JBI. I'm not going to spend a lot of time in these. There's the website for the CASP. I'm just going to click on this. I don't know if that might not work. Oh, you won't see that though. We just went through that, didn't we? So unfortunately, it probably, I won't pull it up because it's just, on the webinar today, it's just too difficult. But there is the CAS website. And it's basically a skills training program, and they have a lot on that website. You can look at that on your own time. There are a lot of tools and courses there that are listed that you can certainly avail of, register for, etc. So you can have a look at that. My apologies, I was going to pull that up, but it's a little bit tricky with this online. The JBI one, like I said, it's just the one that I am most familiar with. Joanna Briggs is an international institute membership based. It's a research and development organization within the Faculty of Health Science at the University of Adelaide. This institute specializes in promoting and supporting evidence-based healthcare by providing access to resources for professionals in nursing, midwifery, medicine, and other allied health. So the JBI has over 80 collaborating centers and entities serving 90 countries, and they are recognized as a global leader in evidence-based healthcare. So its major role is to translate evidence into practice. So the core of evidence-based synthesis is the systematic review, as I said, of literature of a particular intervention, condition, or issue. So the systematic review is essentially an analysis of the available literature, that is the evidence, and a judgment of its effectiveness of a practice involving a series of complex steps. So this is all to aid in good clinical decision making. So I have the website listed there, https jbi.global/. So you want to have a look at their website, and it's quite interesting. It's a bigger website than the CAS, but it does talk about the training opportunities that are available, what they do, the help that they provide. There's also I think it's two journals associated with the Joanna Briggs Institute, where you can publish your systematic reviews or scoping reviews or whatnot. So it's quite an interesting website. You want to have a look at that. I was going to pull that up, but we are certainly, time is another factor. So these, again, I want to get into the critical appraisal checklist for the CASP and the JBI. And I want to go through them in the next few minutes before, and then we'll finish up. These are the important, this is the important aspect of, I guess, this webinar. So going back to what we went through, you know, how to do critical appraising user journal standards or textbook standards. But these checklists, of course, are much more systematic. What I mean by systematic and standardized is that everybody who does these reviews, whether they be from the JBI or the CASP criteria or the Cochrane criteria, these are standardized and they're consistent through all the reviews. So we know all the reviewers are using the same critical appraisal checklist. So again, I'm going to need to go into, maybe I can, let me see, pull this up from my computer screens. Bear with me. Oh boy. So I want to pull up the, what did I do before, Amy? I thought I had it figured out.
So you just open up whatever you want to show.
Okay, I had to get my slide off of there first. That's what's,
Okay, just minimize, because you're not sharing your screen at the moment. So
Yeah.
if you just minimize it and click on your Zoom icon on the bottom of your screen.
I'm just going to have to go through my slideshow because I can't get the slides off of my computer for some reason. The slideshow. Okay, let me see. I'm sharing there now, am I?
No, not right.
Okay,
Mhm.
so I still have this. How do I get out? Okay, right now, here we go. I think I can go down. All right. So actually, I don't have to go online. I have them on my laptop. So I'm going to do the JBI critical appraisal checklist. Okay. And now I hopefully can share my screen.
So are you in the Zoom?
Okay, so I'm in Zoom.
Okay. So on the bottom, you should see share screen,
Okay.
and then just click on the file you want to share.
How are we doing there?
There you go.
Perfect, thank you. Again, my apologies. Okay, so this is the checklist for the Qualitative Research Joanna Briggs Institute Critical Appraisal Tool for JBI systematic reviews. And a little introduction. And so, as you can see, we go down through, and there are 10 critical appraisal criteria, and most of these they center around the methodology. That's what they're really keenly interested in. But as I was stating earlier, they also look at that link between the philosophical perspective, the methodology, the research question or objectives, and the methodology. So they sort of pull out those important aspects that I was referring to earlier. And then there are two or more, usually two, with the systematic reviews, critical appraisal, two qualitative researchers who are trained, but you don't have to be trained to use these checklists. Obviously, they're very clear. And you have 10 items that you would go through with each research article or each piece of evidence and determine, is this particular research credible, dependable? Is it strong evidence? Can we use it in practice? So, for example, is there congruency between the philosophical perspective and the research method? Yes, no, unclear, maybe not applicable. Is there congruency between the methodology and the questions or objectives? Is there congruency between the methodology and the methods of data collection, data analysis, interpretation? Is there a statement locating the researcher culturally or theoretically? Is the influence of the researcher on the research and vice versa addressed, which we talked about earlier? Ethics, and can we draw conclusions from the analysis, interpretation of the data? So your overall appraisal would be to include, exclude, or seek further information. The thing with the JBI critical appraisal checklist is very clear, but if you pull down, they do have for each particular criteria what they're looking for. So it's very well laid out as to, okay, what do we need to do here? So for example, just to read here, a report may state that the study adapted a critical perspective and participatory action research methodology was followed. Here, there is congruence between a critical view, focusing on knowledge arising out of critique, action, reflection, and action research, and action that focuses on firstly working with groups or reflects issues of practice, then considering how they could be different, then acting to create a change, and finally identifying new knowledge arising out of the action. So that will be a congruency. However, a report may state that the study adopted is interpretive and uses survey methodology, which one would certainly wonder, is there congruency between that? There probably isn't. So it gives you examples, it elaborates on what you need to be looking for each of the 10 criteria listed above. So it's very well stated there. Okay, I know this is really quick, but these are things you can look at yourself now that you're aware that they're out there and where to find them. So this is the Joanna Briggs critical appraisal tool used for JBI systematic review. And the website is there as well. Likewise with the CAS, and I was actually, and I thought I'd be finished early, but I guess I had more to discuss than I had originally intended. The CAS as well as a checklist, and it's nice to compare the CAS, which we don't have time right now to pull up. Very similar. Again, they have the criteria and they have an explanation of what you should be looking for within each criteria for the critical appraisal. So the CAS does the very similar thing. And stop sharing this for a second and go back to my slide. And okay, I'm gonna try to pull up share screen. Okay, so these are the websites for both of those tools, the CAS and the JBI critical appraisal checklist. If you want to have a look at those, you certainly can. They're very similar. And those are the ones that we use with the training program for critical appraisal or qualitative research. Now, if you look into the websites for these two, the CAS skills program and the JBI Institute, you will see that there are critical appraisal tools there, not only for qualitative research, but for quantitative research, different types of quantitative research, whether it be a randomized controlled trial or whatever. There are different tools, critical tools that are designed specifically for different types of research. Okay. Just very quickly before we finish, these are some examples of JBI qualitative systematic reviews that I have been involved in, just so that you can get a general idea. You can do it just systematic review on anything. And of course, mine is in nursing, and my area is the aging population. And so these are just some of the ones that, 3 of the ones that I've done. Experiences of older adults accessing specialized health care in rural and remote areas, a qualitative systematic review. Older nurses' experiences of providing direct care in hospital nursing units, and nursing leaders' experiences of upward violence in the workplace. And my colleagues many of my colleagues have done a systematic reviews. It's quite an interesting one here by Dr. Poit, Davin Williams of Swab, the experiences of adults living with an implantable cardiodefibrillator for cardiovascular disease. And the thing is about qualitative systematic reviews, any qualitative question is conducive to a systematic review if there's the literature out there on it, and there usually is something. Sometimes you'll only find a couple of studies, sometimes you may find thousands. We started off with, most of ours started off with a couple of thousand, and by the time we whittle it down to things that are duplicated, things that are not the topic we thought they were, and you know, you can come down anywhere between 3 and 300 in your final systematic review. But the core of the systematic review is a qualitative critical appraisal, and that's the piece that you really need to focus on. And again, to do a systematic review, I would strongly encourage you, if you have the opportunity, to do some training with, you know, it doesn't have to be JBI, but certainly there are a lot of good ones out there. So just to conclude, there are a variety of appraisal tools available to conduct a critical appraisal of qualitative evidence. Tools include texts or criteria standards published in the criteria for authors section from academic journals. They all involve a degree of subjectivity. And there's systematic critical appraisal tools such as JBR or CAS that are specifically designed for use for critical appraisal of qualitative evidence. So they form the foundation of the systematic review of evidence for qualitative research question. So systematic reviews such as those done with JBR CAS, they pull together the literature specific to a particular qualitative research question and grade the quality of this evidence as strong, moderate, or low using a grade system. And the reviewer can decide if the research provides the best evidence for clinical practice. And again, as I said, there's certainly a degree of subjectivity. Do you really think that this research is credible? And we use the word credible, as you probably know, in qualitative, as opposed to valid and reliable, which are mostly quantitative, as quantitative terminology. So we look at credibility, dependability, and those types of things. So is that literature sound? And sometimes you really don't know, you may be on the fence. Is it or isn't it? And that's why a couple of people to flush this out. Should we include this? Is this strong enough? And you know, there's no cutoff saying, you know, 3 no's means you're out, or 4 no's means you're out, or you really had, what no's were they, and how bad was that particular criteria, or how good was it? These are my references, the CAS, the JBI, and the standards that we looked at. Okay, so I know that's a lot of information in a very short time, because this is a big topic, and I just wanted to give you a very brief overview. I think, Amy, we probably have time for a couple of questions, do we?
Yes, thank you for that presentation. Yeah, does anyone have any questions?
And I apologize for all this information.
Oh, there's 2 questions in the chat. So the first one is phenomenology versus grounded theory for lived experiences. Could you explain the differences to consider again, please? Thanks.
Okay, and I don't mind answering that question. I kind of, when I said that in the presentation, I thought I just brought up something somebody's going to ask about, which is really not the focus of what we're talking about here today. But of course, phenomenology at its core is about lived experience. That's what we're looking at when we do phenomenological research, whether it's hermeneutic phenomenology, descriptive phenomenology, you know, whatever the philosophical underpinnings are, you know, whether it's Husserlian, Heideggerian, we are looking at lived experience in a nutshell. Grounded theory is a different methodology. It's got a different background. It's less philosophical, but it does have that theory. It does have a theoretical background as well. What they look at is more psychosocial processes. For example, how do people adapt to losing a child, or living with Crohn's disease? But to say it's not a lived experience is not true. It's still an aspect of lived experience there. But the question, the how question, the overall question for grounded theory is quite different from phenomenology, which kind of directs how you would answer this question. But they're both lived experiences. We're getting people's stories. Okay, and I know that's a very simplified answer. That's basically, in a nutshell, what we're talking about. So does that help, Lucy? Okay.
Okay, there's
Okay, thank you. Okay, good. All right, there's another question there.
Next question is there a database resource that share gradings from previous reviews? Would this be included in additional docs in open access publications?
A database of, if I could see that question, maybe I'd be a little bit clearer. Oh, okay. Is there a database that share grading? There is no database. If you're interested in a particular topic with a particular question, I think it's Martin. There are a lot of journals will publish systematic reviews on the topic. Systematic reviews are published in a lot of different journals. But for example, the Joanna Briggs Institute, that's what they do. They publish systematic reviews, scoping reviews, and implementation reports. So if you have a question, the first thing that I would do, because you have to do the grading that's not published independently as far as I know, unless it's something relatively new. Look at those systematic reviews and see what's out there in your topic of interest, and what some of these have already been done and have been graded. That's the best advice I can give you there.
Okay, there's not a question, just a comment. I don't have a question, but thank you very much for the presentation. Very insightful and helpful. And then could you please provide more tips on doing critical appraisal in a team? You mentioned 3 people. Are all 3 involved in critical appraisal?
That's a very good question, actually. The teams that I am on are generally teams of 3 or 4. I have a partner in crime in critical appraisal. There's 2 of us. We're both trained. One person will take the lead as the PI, in other words. They're usually the first author. They drive the systematic review. It's just as any research. You have your primary, your principal investigator. You need to do the same thing with systematic reviews, because systematic reviews are just not publications. They're basically research. They're research, and they can be funded. There are places that fund systematic reviews. They're a lot of work. So if you're looking, and I'll segue back to where the crux of your question in a second, but if you're looking at somebody's CV and you see a systematic review or 2 there, they are much more heavily weighted, say for promotion and tenure. They are much more heavily weighted than other publications, if you're doing a publication count, because they are in itself their research. And you know, it takes me, and I do them continuously. I pretty much continue to work. It's a couple of years from the time you had to do a protocol of what you're going to do, get accepted, to do the review, to get it to publication. So 2 years, you're flying. So it's a lot of work. You're just not going to whip it up because it's research. So yes, going back to your question, I usually have 3 people, myself and my partner who, at work, who we've both been trained in JBI training. We did our training together. We have a librarian on board. You can have more than 2 people. We work quite well together because both people, not the librarian, and that's part of this question, both people need to do the critical appraisal, because we have gone through the critical appraisal checklist. Say we have 20 articles we're going to do. So then we do them independently. We're not influenced by each other on our grade. We come together and we go, sometimes we're bang on. Yep, that's what I said. And then we'll get a couple of these reviews, those grades, and we'll say, those are critical appraisals. And we'll say, well, you know, I said no for that. And she said, well, I got yes. And then we had to discuss it. And we usually convince each other one way or the other. Okay, you know, you're probably right. That's probably okay. It's a little thin, but I can live with their theoretical underpinning as why I can live with that. But sometimes we sort of butt heads and say, so you can bring in a 3rd person, which is always nice to have somebody else on the team to break that tie. And what do you think? We are both really divided here, which rarely happens with us. And that 3rd person can be the tiebreaker. Now, the 3rd person does have to be trained. Even the 2nd person doesn't have to be trained. But let me tell you, if you're on a team with somebody who's not trained, it's a lot harder because it's a very complex process to do. I don't know if anybody's done them using that training system, but it's a lot of work and it's complicated. It really is. So training is the key. So minimum of 2 people, but somebody that you can work with, somebody that's going to hold up their end, like any project. You know, you have your slackers. I mean, it is what it is out there. And so somebody who's really going to do the work and the expectation that are required to do this review, because if one person's not doing their part, the review will stall. You need 2 people to do the critical appraisal. And usually the PI is the one, like anything, that sort of holds the thing together. But you need 2 people for critical appraisal checklist. That's a requirement. The librarian does not. Her job's up front. She runs the searches. And so all the databases that she runs, when she ran them, all that is a part of the report. I can't do that well. I'm not going to do it well enough. I can do a research, I'm pretty good at it after all these years, but I'm not going to do it well enough for publication. They show every search term, every item, how they did it. It's all listed in tables. So you need that librarian and 2 other people minimum, because 2 people have to do the critical appraisal. Okay, Kayla? Okay, yeah, I might have said your name wrong.
Any more questions? I'll answer your question, Lucy, once these questions are wrapped up. Any more
Sorry?
questions? Oh, sorry, Lucy just has a question for me, but I said I'll answer that question once we wrap up these.
Oh, okay.
Any more questions for Karen? Okay, I think we're good there. So thank you so much again for presenting.
You're welcome. I hope you got something out of it at least. And even if you are very familiar with the process, there's so much. And I thought, oh my God, an hour. This is days. I could spend days on these tools talking about how to, think about it, how to look at it. Even a practice session, sometimes I've done these over 3 hours and I give examples of, team up. And I'll give an example that I know people are going to disagree on the criteria, just to show you how subjective it is and how tricky it can be sometimes. But at least I hope you have an introduction to critical appraisal and systematic reviews. I enjoyed it.
Thank you.
Thank you very much.
Thank you. Bye-bye.
Bye-bye, everyone.
Do you mind just stop sharing your screen? I'm going to pull something up for Lucy, please.
Absolutely.
Okay, thank you.
Right. Okay.
So with regards to your question, so we have, as I mentioned in previous webinars, we have the research design series. So we have monthly webinars from guest speakers. So we are planning for sessions in April, May, and June. From right now, we have From Research to Policy with Cheryl Etchegary on May 5th. With regards to Lucy's question, the free training program is open to anybody. So that's the monthly webinars. To complete 6 sessions, you can sign up to receive a letter of completion at NL support at mun.ca. So I'll just leave that up for a minute if you want to write that down. So you have to register for each event, but the past events, we do have people's who attended. So if you have attended them, you just need to sign up so that we know you want to receive the letter of completion. And if you have any more additional questions, I'm the training capacity lead and patient engagement lead with NL support. So you can jot down my email. I'll leave it up there for a minute. And if anybody has any more questions about it, you can send me an email. All right. So I will leave it there. I don't think anyone has any questions, do they? Okay, perfect. All right. Thank you, everyone.